Hello everyone, welcome to Pediatrics by Dr. Anand. This is the Unacademy NEET PG platform, and this is the third session of cardiology where we're going to talk about very importantly pediatric cardiology videos. And this is the test basically, last test, and we're going to talk about important questions. And we have covered from question number what you called 1 to 60, and in this segment, we are going to speak from question number 60 to question number 100. Anji, Osama Sheikh, Hamid, वैदेही, good evening. खाली बैठे हो सब टाइम पे आते हैं. Why so much discipline in this class? Why everyone comes on time? Don't have any other work. Everyone comes 4:30 dot. हाँ जी संधू सावन अच्छा अलार्म लगा के आते हो इतनी जल्दी तो मैं भी नहीं आया. हाँ जी चलो let's start. Good evening everyone. This is the Unacademy NEET form and this is Dr. Anand. We're going to talk about what we called our pediatric cardiology series. And yes, we're going to start with our beautiful this one. My name is Dr. Anand. And for the newcomers, first of all, in the Unacademy, we have something known as plus subscription and something known as iconic subscription. In the plus subscription, what do you get? Nothing. You get only me. You get to access all the amazing what you called in the Plus subscription, you get to access all the live and recorded classes of all the faculties. You get to study from the best of the best educators all over the India. You get to participate in various live tests and quizzes, and also you can watch me on your Android, on your laptop, and on your iOS. This is the Plus subscription. Okay, then we have iconic subscription. In the iconic subscription, dear, you have the Unacademy platform and also the Prep Ladder subscription. All the clinical notes, video lectures, question bank, rapid revision, the dream notes. So this is the iconic subscription. Okay, so remember, most importantly, two we have the plus and we have the iconic subscription. Being an MBBS student, sometimes it's difficult to take a big pack. So if you use this cute, mind-blowing, super duper hit code that is Dr. Anand, will get some financial benefit. That's it. Okay, and also we have made a very beautiful Focus FMG 2022 batch and a target NEET PG 2022 MCQ discussion batch. Okay, hello Raghuvansh, hello Akshay, hello Hamid, hello Exportin. Exportin says my food is coming now, sir. खाना आया है खाओ please have your food. Go from the class bro, no problem, please have your food and come back. Okay, Mani, good evening. And Savan, मेरा वाईफाई नहीं चल रहा, वर्किंग फ्रॉम द मोबाइल हॉटस्पॉट. ओके, मेरे घर आ जा, तू मेरे घर आ जा. Savan is for everyone. Savan is one of my junior. He stays near to my house. And Savan, you come at my home, sit with me. Let's take a class together. Okay. And yes, and today's beautiful motivating quote is nothing but holding on to anger. Holding on to anger is like drinking poison and expecting the other person to die. So, holding on to anger is like drinking poison and expecting the other person to die. So, most importantly, for everyone, don't have any negative thing in your mind. Never be angry. Be a calm and a peaceful soul. Tell yourself that you are very strong. You are very perfect. You're a happy soul. You're a peaceful soul. Okay. So please don't be angry ever. Okay. As I may write a note. सावन कह रहा है आ जाता हूँ तू आ जा यहीं रहता हूँ राजा पाके रेड लाइट के पास आ जाओ ठीक है सो होल्डिंग ऑन टू एंगर इज लाइक ड्रिंकिंग पॉइजन एंड एक्सपेक्टिंग द अदर पर्सन टू डाई. So this is the mystery of life. Let's start the mind-blowing quote, and this session will be spoken in English and Hindi language. ये जो है क्या बोलते हैं वेबिनार हिंदी या तथा नहीं हिंदी और इंग्लिश भाषा में बोला जाएगा. अगर आपकी हिंदी अच्छी हो तो प्लीज़ इस सेशन को अटेंड करें. And that's it. So question number 41. Question number 41 is which is the most commonest type of TAPVC, which is the most commonest type of total anomalous pulmonary venous connection. The options are supracardiac TAPVC, cardiac TAPVC, infracardiac TAPVC or none of the above. क्या जवाब देंगे यार इसका? क्या इस एग्जाम इस क्वेश्चन को आप छोड़ के आएंगे? फिर छोड़ के आगे जब मुझे बताएंगे तो मेरे से आप सुनेंगे अच्छे से क्योंकि ये बहुत ही हल्का और सिंपल सा क्वेश्चन है. So question number 41, the most commonest type of TAPVC is supracardiac. Supracardiac TAPVC, yes or no? Very good. Yes, that's right. People who have given right answers are Raghuvansh, Tanu, Vaidehi, Rachna, Staphylococcus, Sandhu, Mini, Osama, Hamid, and Mona Lisa. Mind blowing. Question number 42. Name the surgical procedure done in hypoplastic left heart syndrome. Name the name of the procedure done in a case of hypoplastic left heart syndrome. Anyone? Any random guesses? Okay, very good. So what do you think? Anyone? Anyone? Very good. So Nishi Agarwal is right. Mani is right. Rachna is right. सावन कहाँ पे है? Vaidehi is right. Osama very good. Mind blowing. बहुत ही बेहतरीन जवाब दिया है और आपको मिलते हैं 100 करोड़ रुपए। 100 करोड़ कौन देगा? अपना एटीएम का नंबर बताओ, मैं पैसे निकाल के आपको दे देता हूँ। The surgical procedure of the for hypoplastic left heart syndrome is nothing but Norwood. Is nothing but Norwood procedure. Norwood procedure, right? Okay, and also at the same time I would like to thank of one of our student we have in our group is Combat, and yeah, his name is Deepak. He just came recently, he came to my home, and he just met me, and thank you so much, Deepak, for meeting and sparing time for meeting me for 2 minutes, and he got a wonderful cake and sweets from his house. And thank you so much, Deepak. God bless you, and please come, keep coming to Delhi, and next time I'll make you have aloo parathas with family. Okay, thank you so much. Question 43. Which congenital heart disease has the finding shown in the image? Very nice question. Anyone? So yes, which congenital heart disease has the finding shown in the image? The options are supracardiac TAPVC, cardiac, infracardiac TAPVC, coarctation of aorta, and atrial septal defect. Question number 43. Anyone? I'll just zoom the picture for you guys. Can anyone tell me what is this? है ये है क्या? What do you call this sign? सावन सिंह? हाँ जी। सावन क्या देगा? सावन तेरे भाई तेरे कमेंट्स आ रहे हैं, क्यों टेंशन ले रहा है? यस, योर कमेंट्स आर कमिंग ब्रदर. So yes, can we appreciate what is this? What is this? What do you call this condition? Yes, the best answer is coarctation of aorta. There is no doubt about it. Yes, most importantly, we have figure of 3 and figure of 8. Yes or no? So figure of 3 appearance on the X-ray is nothing but seen in coarctation of aorta. Please remember, we have something known as figure of 3 and figure of 8. No, notching of ribs is not seen in this one. What do you call Vedahi? Notching of ribs basically is the other finding. I'll show you in the other X-rays. But the notching of ribs, I would have shown you the arrow over here. See this. Here I would have shown you the arrow. Are you understanding this one? This would be the notching of ribs. The inferior rib notching is a chronic late finding of coarctation of aorta. But this one, this very important, is nothing but figure of 3 appearance. Figure of 3 appearance. Okay, Combat, you're already came, bro. You are in the cab going to the railway station. How come you are online right now? Magic. So the question number 43, it's a figure of 3 appearance which is seen in coarctation of aorta. Question number 44. Yeah, this is a good question. Today only, guys, we were discussing about it this in the morning class. Pink upper limbs and blue lower limbs. Pink upper limbs and blue lower limbs is known as what? This is known as reverse differential cyanosis, partial cyanosis, or total cyanosis? Anyone? What do you think? Why the he? Anna? Very good. So Staphylococcus says this is known as reverse differential cyanosis, but Savan says it is known as differential cyanosis. Anyone? Which is the best answer? Which is the best answer? The person who will give the best answer will win the keys of my car. Okay, now tell me the right answer. Yes, exactly. So question number 44, dear, the question number 44 is nothing but, very importantly, we have something known as differential cyanosis and reverse differential cyanosis. Please remember, this is a very important slide. When the lower limbs are more blue than the upper limbs, when lower limbs are more blue than the upper limbs, this is known as differential cyanosis. And when the upper limbs are more blue than the lower limbs, this is known as reverse differential cyanosis. One is differential cyanosis, one is reverse differential cyanosis. Very good. Yes, my dear Savan, you are very right. One is differential cyanosis and one is reverse differential cyanosis. When the lower limbs are more blue than the upper limbs, that is known as differential cyanosis, and opposite of that is nothing but reverse differential cyanosis. Reverse differential cyanosis. Hanji, the keys of my car I have only right now. XUV BMW we will buy one day. Right now I have. Okay, so question number 44 and 45 is over. Question number 46. Which one of the following is an example of differential cyanosis? Which one of the following is an example of differential cyanosis? The options are PDA with a reversal of shunt, persistent pulmonary hypertension of newborn, hypoplastic left heart syndrome, interrupted aortic heart syndrome, and all of the above. क्या लिख के आएंगे आप? वेर इज पैनकेक? पैनकेक सो रही है, आज पैनकेक नहीं आई है, पैनकेक पैनकेक खा के सो गई, पैनकेक नॉट कमिंग टुडे. हाँ जी. एग्जैक्टली. ओके, रिमेंबर वन थिंग गाइज. हाँ जी. हाँ जी, यस संधू. BMW की चाबी चाहिए तुम्हें, आओ आओ दिल्ली आओ। हाँ जी, see remember dear my friends, the best answer for this question, question number 46. I agree with you that PDA with reversal of shunt, of course in the morning class we had discussed about it, question number 46. But remember now this is the one hi-fi question, question number 46. These all are the examples of differential cyanosis. Please put in your notes star mark. We'll talk about it one by one, why hypoplastic left heart syndrome and why interrupted aortic heart syndrome is an is used in differential cyanosis. We will talk about it in some class, but right now as for notes, just write it that the differential cyanosis, when the lower limbs are more blue than the upper limbs, you see in multiple conditions, not even just PDA with reversal of shunt, with PPHN, HLHS, IAAS, interrupted aortic heart syndrome, all these conditions you will see differential cyanosis. What will you see? Differential cyanosis. Pancake, okay, pancake come. Welcome pancake. Guys, everyone, can we welcome pancake? पैनकेक पधारिए, सब लोग केक लाओ पैनकेक के लिए। तीसरी क्लास है आज और भी बंदी अब आ रही है। वी आर थर्ड इज द थर्ड क्लास फॉर टुडे सेशन एंड नाउ यू हैव कम पैनकेक। प्राउड ऑफ यू, सो प्राउड ऑफ यू, सो नाइस। बहुत अच्छे नंबर आएंगे, ठीक है। Next question. Question number 47. Which one of the following is an example of reverse differential cyanosis? Which one of the following is an example of reverse differential cyanosis? Please, can we spend 10 seconds on this question 46 and question 47? Please write in your notes once you revise my video classes of this pediatric cardiology. At least question 46 and 47 are very, very, very important. Actually, this question number 46 and 47 are super specialty question. They have come in NEET super specialty exam. Anyone planning to give DM should definitely answer, should learn these questions. So question 46 and question 47, please do not forget. Okay, question 46. Which of the following is an example of differential cyanosis? All are the example of differential cyanosis. PDA with reversal of shunt, persistent pulmonary hypertension of newborn, hypoplastic left heart syndrome, and interrupted aortic heart syndrome. And at the same time, the reverse differential cyanosis, the best example is TGA with PDA with or without coarctation of aorta. You have a TGA, the like instead of pulmonary artery, this aorta, and instead of aorta, this pulmonary artery with patent ductus arteriosus, which is good. Which is good if I keep a PDA open with or without coarctation of aorta. Yes. Video stuck. Is my video stuck? Yes or no? Let me see if I'm using 2G or 5G. I'm using 5G. Is my voice coming to everyone or the video lagging? Yes or no? Please let me know. Okay, great, great, great. Hmm. ओके, क्वेश्चन नंबर 48, क्वेश्चन नंबर 48, यस ठीक है, आ रही है आवाज, ठीक है डॉक्टर प्रिया। क्वेश्चन नंबर 48, रेमिनेंट ऑफ डक्टस आर्टेरियोसिस इज व्हाट? वेरी इजी क्वेश्चन. So we have a mix of tough and easy questions. The remnant of ductus arteriosus is what? The options are ligamentum venosum, ligamentum arteriosum, ligamentum teres hepatis, and median umbilical ligament. Very easy question. ये तो I think anyone can answer this question, right? Okay, Sandhu says ligamentum venosum. Okay, okay, what do you think? Yeah, Sandhu, remember, dear, ductus venosus. The remnant for ductus venosus will be ligamentum venosum. For the remnant of ductus arteriosus will be ligamentum arteriosum. है ना? आवाज आ रही है? ओके, अच्छी बात, बहुत अच्छी बात। ठीक है, समझ में आ गया। संधू, फिर ए क्यों बोला? ए क्यों बोला? अभी बी बोल दिया, ऐसे कैसे? मजाक चल रहा है? मजाक? शादी में आई हो तुम, घूमने आई हो, अभी ए हो गया फिर बी हो गया, अभी आप सी बोल दोगे? एक चीज yeah, just kidding, bro. Okay, so the remnant of ductus venosus is ligamentum venosum. The remnant of ductus arteriosus is ligamentum arteriosum. It's a very simple question. Question number 49. Which of the following is the remnant of umbilical artery? Which of the following is the remnant of umbilical artery? Question number 49. Good question. Total 100 question we have to do. It's already 4:45. Hanji, batao. So, which one of the following is the remnant of umbilical artery? Is it ligamentum venosum? No, I don't think so. Is it ligamentum arteriosum? No, I don't think so. What about ligamentum teres hepatis and medial umbilical ligament? What about, yes, exactly, yes. Ligamentum teres hepatis or medial umbilical ligament, right? Two options we have. What will you choose? Question number 49. So question number 49, the best answer is median umbilical ligament. You say medial or median, depends, but medial umbilical ligament is the remnant of umbilical artery. Medial umbilical ligament is a remnant of yeah, the remnant of umbilical artery is medial umbilical ligament. Okay, so Basant, Adi, and Mani Prakash, remember that. Okay, D is the best option. The remnant of umbilical artery is medial umbilical ligament. Okay, which is the remnant of umbilical vein? Question number 50. Which is the remnant of umbilical vein? So umbilical vein में क्या रह गया? Any idea? Which is the remnant of umbilical vein? The question number 50, the remnant of umbilical vein is nothing but ligamentum teres hepatis. Ligamentum teres hepatis. Okay, are you understanding? Every question has a point. Okay, every question I had a point. Okay, yes. So the remnant of umbilical vein is nothing but ligamentum teres hepatis. Question number 50. The C is the best answer. Yes, the people who have participated right are our Hamid, Nishi, Priya, Vaidahi, Mona Lisa, Raghuvansh, Tanu, Sandhu and Mani Prakash. वेरी गुड. तो ये याद रखना है गाइस. आर यू विद मी? पुट अ लाइक बटन इफ यू आर एबल टू अंडरस्टैंड. समझ में आ रहा है या समझ में नहीं आ रहा, या दिमाग के ऊपर से जा रहा है या घुटने के नीचे से जा रहा है? The remnant of umbilical vein is ligamentum teres hepatis and the remnant of umbilical artery is nothing but medial umbilical ligament. इसको नहीं भूलना. Don't forget this. This is important. Okay. Question number 51 is a very easy one. Which of the following is the remnant of ductus venosus? So Sandhu, now what will you answer? Okay, Pancake says Staphylococcus. Whenever I see your name, it reminds me of golden yellow colonies of staph warriors. That's true. आई एग्री विथ यू. ठीक है, रघुवंशी समझ में आ रहा है. हाँ जी, सावन सिंह बहुत बढ़िया. ठीक है, विच ऑफ द फॉलोइंग इज अ रेमिनेंट ऑफ डक्टस विनोसिस? लिगामेंटम विनोसम. क्वेश्चन 51, द बेस्ट आंसर इज ए, लिगामेंटम विनोसम. वेदर ही इज राइट. तनु, संधु, रघुवंश, रचना, ओसामा, हामिद एंड हामिद तो ए कर रहा है. वेरी गुड, नाइस. Question number 52. The most common congenital heart disease. Yeah, this is a good question. Star mark. The most common congenital heart disease affected by infective endocarditis. Most common congenital heart disease which is affected by infective endocarditis. What is the best option we have? Anyone? Hmm. Okay. I erased it. My DP. Okay. Hanji, the most common congenital heart disease affected by infective endocarditis. Anyone? Question number 52. I think the best answer should be exactly patent ductus arteriosus. Always remember, my dear friends, I told you the four-chambered heart, right? And here we have the patent ductus arteriosus. This one. This is the PDA, right? So remember one thing, PDA is very close. PDA is very close to the pulmonary artery here, okay? So that's why infection and infective endocarditis is very common. Infective endocarditis is very commonly associated with number one, PDA. Second, it is commonly associated with VSD, and very less likely it is associated with ASD. ASD wale cases mein you don't see. In a cases of atrial septal defect, you don't see infective endocarditis. Infective endocarditis is very common for the defects who are very close to the pulmonary artery, and PDA is number one of them. And second will be our ventricular septal defect. Ventricular septal defect. Yes, our C is the best option. Very good. Hamid, Nishi, Staphylococcus. Mind. Question 53. Which congenital heart disease is most commonly seen in the child shown below? Yes. This, I saw this child in my own eyes. It was referred from AIMS, and this boy has a what you called a male with a webbed neck. A male with a webbed neck. क्या जवाब देंगे इसका आप? तो छोड़ के आएंगे एग्जाम को? क्या करेंगे आप? भगवान का नाम लेंगे इसमें? द क्वेश्चन इज, व्हाट इज द क्वेश्चन? Which congenital heart disease is most commonly associated in the child in the image? Hanji, what do you think, anyone? What will you answer? Yes, exactly. You will answer my name. Hanji, very good. The best answer for this question is Noonan syndrome, right? So the best answer for this question is nothing but, who will tell me? Noonan syndrome. And the most common congenital heart disease in Noonan syndrome is, who will tell me? The most common congenital heart disease in Noonan syndrome is pulmonary stenosis. Pulmonary stenosis. किसी ने गलत जवाब दिया, जरा मैं उसका नाम ऐलान कर दूं. हाँ जी, सावन इज राइट. सावन, ओके. रचना इज राइट. वैदही इज राइट. सारिका इज राइट. रघुवंश. वेरी न्यू नेम्स वी हैव in class also. Pancake. I can, for that you got it. Okay. अच्छा जी, ये जी क्या बात है. Question 54. Question 54. Which is the most common cardiac cause of death in child shown in the image? Which is, I'll little zoom out the picture. Yes. Option बहुत सारे तो नहीं है, इतने ही है. हाँ ठीक है. Which is the most common cardiac cause of death in a child shown in the image? The options are ASD, PhD, PDA, bicuspid aortic wall and coarctation of aorta. हाँ जी, डॉक्टर सावन सिंह. हाँ जी, बहुत बढ़िया रघुवंश, वेरी गुड वेरी गुड। संधु सेज डाउन सिंड्रोम। डियर डाउन सिंड्रोम तो नहीं लग, कैसे पता ये डाउन है? हाउ डू यू नो इट्स अ डाउन syndrome? See Sandhu, if I wanted to put a picture of Down syndrome, then I would have put a picture of single palmar crease. Yes or no? Single palmar crease. I would have shown you a baby, kind of with the mouth wide open, with kind of protruding tongue. I would have shown you a baby with, kind of a depressed nasal bridge, maybe a low set ears, and with mongoloid slant. Yes or no? These all are the hi-fi features of what you called Down syndrome, right? Down syndrome. But right now, this picture, what is this picture? This is a female child. This is a female child. And it's okay, forget male or female. What can you see? What is this? Can we see a webbed neck? Yes or no? Webbed neck, yes or no? So webbed neck is not seen in Down syndrome, na? Webbed neck in a female is seen in Turner syndrome, yes or no? Turner syndrome. And the most common congenital heart disease in Turner syndrome is bicuspid aortic valve. But I'm asking the cardiac cause of death. The most common cause of death in Turner syndrome is coarctation of aorta. Coarctation of aorta. ठीक है, समझ में आ गया? ठीक है, समझ में आ गया? हाँ जी। ये पैनकेक एंड स्टेफिलोकोकस, अगर बातें हो गई हो बहुत सारी प्यार मोहब्बत, तो क्या हम आगे बढ़ सकते हैं? क्या हम कॉमन डिस्कशन की बातें कर सकते हैं? थैंक यू, वेरी नाइस। हाँ जी, सो समझ में आ गया, डन। संधू का है, संधू डिड यू अंडरस्टैंड, यस और नो डियर? Did you understood, right? This was not a Down syndrome, dear. This is a female with a webbed neck seen in Turner syndrome. And most common congenital heart in Turner is bicuspid aortic valve. And most common cause of death in Turner is coarctation. Question number 55. Which is the most common cause of cyanosis in a child? Which is the most commonest cause of cyanosis in a child? The options are ASD, VSD, PDA, and TOF. What will you answer? हाँ जी, होगी। कोई बात नहीं संधू, चलेगा, इट्स गुड। आई एम टेलिंग यू माय डियर फ्रेंड्स, इट्स अलाउड टू डू मिस्टेक्स हियर। अपनी बेइज्जती कराओ जितनी हो सके, करो मिस्टेक्स, गलत आंसर लिखो, चलेगा। डू लॉट ऑफ मिस्टेक्स, डू लॉट ऑफ मिस्टेक्स हियर। Why? Number one, because mistakes are proof that you are trying. And number two, these mistakes you will not do in the exam. We have to get rank one, every one of you. Pancake, me, Sandhu, Savan, Priya. I want you to be the best of the best of the best in pediatrics. Okay, and I'm trying my best to make the topics so simple. And these are very difficult topics actually. नानी याद आ जाए अगर अकेले पढ़ने बैठ गए तो। ये बहुत हाई फाई टॉपिक्स हैं, बट वी आर डीलिंग इट इन अ वेरी सूदिंग एंड वेरी हैप्पी वे, so finish them fast. हाँ जी, हामिद क्या कहता है? Yeah, of course. Question 55, tetralogy of Fallot. Tetralogy of Fallot, you will see cyanosis in a child, whereas ASD, VSD, and PDA, they all are left to right shunt, and they all are acyanotic congenital heart disease. है ना? Yes or no? Very good. बहुत ही बढ़िया जवाब। Question 56. So only 40 more question, then this class is over. कितने बजे चालू किया था? अच्छा, हाफ एन आवर खत्म भी हो गया। टाइम तो ऐसे बीतता है पानी की तरह। Half an hour over, only 15 minutes left, then this class is over. Which is the most common cyanotic congenital heart disease beyond neonatal period? Very easy question. Which of the, okay, Sahil Gandhi, Ehlers-Danlos syndrome. कहाँ है? Which topic, dear? Which point you are spelling Ehlers-Danlos syndrome? Why you feel Ehlers-Danlos syndrome is the cause of what you call death? Is the cause of death in Ehlers-Danlos syndrome is coarctation of aorta? What do you think, dear? If it was Ehlers-Danlos syndrome, I would have told you, hyper flexible joints, joint laxity, repeated fractures. I would have given you those hints. Yes or no? So question 56, which is the most common cyanotic congenital heart disease beyond the neonatal period? Of course, the answer is tetralogy of Fallot. Tetralogy of Fallot. Question 57, a little rare question. Which is the most common site of cardiac myxoma? Which is the most common site of cardiac myxoma? Hanji. Yeah, that's right. Doctor and caffeine. Yes, you're right. So, question 57, we have not told in the theory classes. So, what will you write and come? Which is the most common site of cardiac myxoma? Is it right atrium, right ventricle, and left ventricle? Question number 57. So, please remember for question number 57, the most common site of cardiac myxoma is left atrium. Left atrium. दिल की बात है, लेफ्ट साइड में। ओके, द मोस्ट कॉमन साइट ऑफ कार्डियक मिक्सोमा इज नथिंग बट लेफ्ट एट्रियम. People who have told the right answer are Sarika, Tanu, Hamid, Dr. Basant, And Tanu told first B, then she told A. Okay, fine. ठीक है, done, चलेगा, no problem. Please update in your notes, my dear friends. Update in your notes. Question number 58. Which of the following is not a cyanotic congenital heart disease? Which of the following is not a cyanotic congenital heart? The options are tetralogy of Fallot, truncus arteriosus, transposition of great arteries, atrial septal defect, and tricuspid atresia. So, which of the following is not a cyanotic congenital heart disease? What do you think? Which of the following is not a cyanotic congenital heart disease? Very good. In option number A, B, C, D, in all the tetralogy of Fallot, truncus, in tetralogy, okay, so in tetralogy of Fallot, we have a component of pulmonary stenosis. So that makes the congenital heart cyanotic. In truncus arteriosus, we all know that we have a four-chambered heart, but down we only have a single vessel. It is a single one vessel. So mixing of blood will take place, leading to cyanosis. In transposition of great arteries, also we all know that we have a four-chambered heart, but here instead of pulmonary artery we have aorta, and here instead of aorta we have pulmonary artery. So now this condition also has a huge cyanosis. Then coming to tricuspid atresia, we all know that in a case of tricuspid atresia, this is the tricuspid valve, and there is atresia, kind of a blockage. So the blood from the right atrium will not able to go to right ventricle, and from the right ventricle the blood will not able to go to pulmonary artery. So means the blood will be cyanotic. It will be a cyanotic congenital heart, because somewhere there is decreased pulmonary blood flow. The blood is not going towards the lung for the purification, leading to cyanosis. Whereas atrial septal defect is a left to right shunt, and it is acyanotic congenital heart. Yes or no? Okay. Okay, okay, pancake. Okay, fine, chalega. Question 59. Which syndrome does this image depicts? Very nice, very nice, very nice question. In the last class, we have done this. Which syndrome does this image depicts? The options are Down syndrome, Edwards syndrome, Patau syndrome, Williams syndrome, Allegany syndrome, and Prader-Willi syndrome. सावन बहुत अच्छा आंसर दे रहा है भाई, बहुत अच्छा, वेरी गुड सावन, आई एम सो प्राउड ऑफ यू. यू आर जस्ट इन फाइनल ईयर एंड आंसरिंग सो वेल ब्रो. टेल योर मॉम दैट आनंद सर बहुत तारीफ कर रहे थे. ठीक है, और कल खाना बहुत टेस्टी था, बता देना उनको. ठीक है, हाँ जी. What do you think? हाँ, very good. So this is nothing but elfin faces. Yes or no? Elfin faces, or you can say some book says like elves. In the German mythology, this person, this creature is worshipped as a supernatural being. This creature is worshipped as a supernatural being in German mythology. In German mythology, and this is nothing but known as elfin faces. Elfin faces, nothing but elves. And where do you see such things? Do you see at सावन की शक्ल है इसके अंदर? नहीं, ऐसा नहीं है. This is nothing but Williams syndrome. Nothing but Williams syndrome. Williams syndrome. And which is the most common congenital heart in William? Who will tell me? Hmm. अच्छा ठीक है, मम्मी नहीं मानती मेरी कोई तारीफ. मैं घर आऊँगा तेरे, ठीक है. बिफोर यू गो टू यूक्रेन, 29th यू आर गोइंग टू यूक्रेन, राइट? Before that I'll come to your house and give regards to your family. Williams syndrome. Which is the most common congenital heart disease? The most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis. Supravalvular aortic stenosis. The most common congenital heart disease in Williams syndrome is supravalvular aortic stenosis. That is one question. Acha, Williams syndrome ki, can anyone tell me any other highlighters? I have forgotten about Williams syndrome. I have to give my PG exam. So can you tell me some two, three rough, any fast important points? One point you told me that this person is worshipped as a in German mythology as a supernatural being, and this is known as elves or elfin faces, right? Any other what do you called any other क्या बोलते हैं finding? Number one, very importantly, starry burst iris. Starry burst iris, that is one thing I told you. Very importantly, other, what else I told you? क्या था? Broad smile. Yes or no? Broad smile. याद है कि नहीं याद? अगर नहीं याद तो देखो बेटा, जान से मार देना. मैंने याद है डॉक्टर सावन, आपको याद आ रहा है कि नहीं आ रहा? वेरी गुड. ब्रॉड स्माइल. हैव यू हर्ड ऑफ ग्रीगेरियस पर्सनैलिटी? Gregarious मतलब outgoing personality. Yes or no? For every single classes of my videos, I want you guys, everything should be on your tips. मजाक और प्यार मोहब्बत अपनी जगह है बेटा, अगर सवाल का जवाब नहीं दिया ना तो मुझसे बुरा कोई नहीं है फिर. Gregarious personality, number one. Broad smile, number two. Starry burst iris number 3, very important. And very importantly, this one, do you see hypocalcemia or hypercalcemia in Williams syndrome, my dear friends? Do you see hypocalcemia or do you see hypercalcemia? What do you see in Williams syndrome? क्या क्या लिख के आएंगे आप, बताओ जल्दी. हाइपरकैल्सीमिया याद है कि याद नहीं? संधु याद है? निशी मनी सावन ब्रो याद है कि नहीं याद? हाइपरकैल्सीमिया. And last question, which was the syndrome you see hypocalcemia? Which was the syndrome where we see hypocalcemia? Anyone? Any random guesses? Exactly. So we see in hypocalcemia in nothing but Dye-George. Dye-George syndrome. Dye-George syndrome, we see hypocalcemia. In Dye-George syndrome, we see hypocalcemia. In Williams syndrome, we see hypercalcemia. Right? So please put a like button or say a yes, yes, that you have understood this much, because we are covering very important and good quality questions on pediatric cardiology. मुझे मेरा एक मैसेज भी आ रहा है. मी वन. ओके, तो मैं आ गया. हाँ जी. ठीक है, डन. पीस आउट. एग्जैक्टली, वेरी गुड सावन, वेरी गुड. नेक्स्ट क्वेश्चन. हाँ जी, क्वेश्चन नंबर 60. विच इज़ द मोस्ट कॉमन कंजेनिटल हार्ट डिजीज एसोसिएटेड विद दिस पिक्चर? Which is the most common congenital heart disease associated with this picture? So we know that the most common congenital heart in Williams syndrome is supravalvular aortic stenosis. Supravalvular aortic stenosis. Done. Question number 61. What happens to the calcium level? अच्छा, already मैंने question पूछ भी लिया है, सारे MCQs हैं. What happens to the calcium level in this syndrome? Anyone? What happens to the calcium level in a case of or in a case of Williams syndrome? The calcium level, nothing, they increases. There is a yeah, moderate to high range, yeah, just increases. Question 61, I think the best answer would say is nothing but increases. The calcium level increases in a case of what you called Williams syndrome. Okay. Okay, 1 second. और कुछ. ठीक है, done. Will I be fine in MBBS and mild essential? Okay, yeah, you'll be fine if you have a little. ओके फाइन, चलो चलेगा. अच्छा, आगे चलते हैं. हाँ, क्वेश्चन नंबर 62. अरे ओ, बात हो रही है. हाँ जी, रेमिनेंट ऑफ फोरामिन ओवेल. व्हाट इज द रेमिनेंट ऑफ फोरामिन ओवेल? ओके, क्वेश्चन नंबर 62. द रेमिनेंट ऑफ फोरामिन ओवेल इज नथिंग बट फोसा ओवालिस. यस, वी ऑल नो दैट. एग्जैक्टली. इज द वीडियो स्टक, यस और नो? स्टक स्टक, अच्छा स्टक स्टक. तो वाई नॉट रीडिंग माई मैसेजेस? कार्डियक मास्टर, एक सेकंड. इतने सारे मैसेजेस पढ़ता हूँ, 2 मिनट 2 मिनट. इज माई वॉइस कमिंग और नॉट कमिंग? पहले तो भैया ये बताओ, इज द वीडियो स्टक और नॉट स्टक? is actually pancake, we have a WhatsApp group of my hospital, no, they are talking about some important case. That's why मेरी नज़र वहाँ पर भी है. Is my voice coming? Is the video is getting stuck or is this video okay? If this is video okay, question number 62. Acha, okay, fine. Question number 62, what you called, the remnant of foramen ovale is fossa ovalis. The remnant of foramen ovale is fossa ovalis. Okay. Question number 63, filling the blanks. Functional closure. Functional closure of ductus arteriosus occurs in what? Functional closure of ductus arteriosus in how many hours? This is a very good question. Okay, Tanu, who can tell me? Question number 63. We're going to finish this session as soon as possible. Functional closure of ductus arteriosus. See, we have anatomical closure of ductus arteriosus and we have functional closure of the ductus arteriosus. कौन बताएगा? कौन बताएगा? मुझे तो याद नहीं है. I don't remember. Anyone can help me out? Sarika? I think Sarika is telling better answer. See, ductus arteriosus, right? Ductus arteriosus, which is between the pulmonary artery and descending aorta, right? It normally should get close. Normally, ductus arteriosus is present, is open in fetal circulation. Once the baby is out, ductus arteriosus slowly start getting close. Okay, so we have functional closure and we have anatomical closure. So question number 63, the best answer for this one is yes. Good question, Ira. 10 to 15 hours and 10 to 21 days. 10 to 15 hours and 10 to 21 days. The functional closure, the functional closure of the ductus arteriosus occurs in 10 to 15 hours, and anatomical closure of ductus arteriosus occurs in 10 to 21 days. याद रहेगा नहीं रहेगा? Very good. तनु, ठीक है, 10 to 15 hours and 10 to 21 days. पहले होगा functional automatic closure, then we have anatomical closure. Okay, remember that. Please, my dear friends, this is the important pediatric cardiology video. We must नो ईच क्वेश्चन लाइन बाय लाइन. ठीक है, खत्म करो अंताक्षरी लेके प्रभु का नाम. ओके, ट्रू और फॉल्स. anatomical closure of the foramen ovale, anatomical closure of the foramen ovale takes around months to years. Yes or no? True or false? Question 65. क्या लिख कर आएंगे आप? The anatomical closure of the foramen ovale takes around months to year. Is this line true or is this line false? Anatomical closure. Okay, and yes, so question number 65, remember the best answer is true. Okay, remember this anatomical closure of the foramen ovale, it really takes around months to year. Yes, thank God, very good. Who has said true? सबको आता है ये आंसर. थैंक गॉड. मनी इज राइट, रघुवंश इज राइट, सारिका, ओसामा, प्रिया, हामिद. वेरी गुड, वेरी गुड, वेरी राइट, नाइस, परफेक्ट. ओके. Okay. Yeah, perfect. Very good. So, anatomical closure of foramen ovale takes around months to years, and anatomical closure of ductus venosus occurs in 7 days. Please, these are tongue twisting questions. You must understand. At least don't forget about ductus arteriosus. Please don't forget about ductus arteriosus. 10 to 15 hours and 10 to 21 days. Ductus arteriosus, some PDA is something they always ask you question. Continuous machinery murmur, easily palpable dorsalis pedis artery, hyperdynamic precordium. Yes or no? Bounding pulses. We have a ductal steel phenomenon. याद है नहीं याद? सावन याद है कि यही नहीं याद है? ठीक है. हाँ. Pancake. Pancake is saying, so show your marriage photos folder. Instagram पे. It is on Instagram. It is okay. I'll post on the one. You can nicely see. Okay. So question number 67. क्या होगा pancake तुम्हारा? क्या होगा मुझे बताओ. Question 67. What is the order of closure of the valves in fetal circulation? Yeah, this is again a super specialty question, not for PG. It is for super specialty actually. हाँ जी. What do you called? क्या कहते हैं? What is the order of the closure of the valves in fetal circulation? Okay, who will answer? Give me a random guess, guys, and I will tell you the right or wrong answer. Give me a random guess. What do you think? What is the order of closure of the valves in fetal circulation? कैसे होगा order of closure? Okay, anyone? Random A, B, C, D. What do you think? Then I'll tell you a mnemonic, and then we'll finish it off. Yes, the best answer for this question. Very good. सावन ने दिया आंसर. ओसामा ने दिया. ठीक है. ओसामा अच्छे से नंबर लाने सर पहले बता रहा हूँ मैं. The best answer for this question is option number D. The order of closure of the valves in fetal circulation is the mnemonic is UVA F. UVA F. That's the order of closure of the valves in fetal circulation. Number one, umbilical vein, starts getting closed. Then we have ductus venosus. Then we have ductus arteriosus, and then we have foramen ovale. The mnemonic is UVA F. The mnemonic is UVA F. And this is the order of the closure of the valves in the fetal circulation. Okay? UVA F, umbilical vein, ductus venosus, ductus arteriosus, and foramen ovale. Order of closure of the valves in fetal circulation. The mnemonic is UVA F. Okay, done. Question 67 over. Question 68. Yeah, this is a good question. Yeah, ductus venosus is a bypass shunt. Ductus venosus is a bypass shunt between what and what? You remember that the baby was there, and in the baby, what happens once the two artery and one vein, when umbilical vein with the deoxygenated blood enters the baby, first it goes to the baby's liver, where it bypass the liver with the help of a component that is known as ductus venosus. Yes or no? So the question is, ductus venosus is a bypass shunt between what and what? Savan, what do you think? Ductus venosus is a bypass shunt between what and what? It is between the, who will tell me? नीचे क्या है ये? This is the, what do you call, anyone? Yeah, exactly. Liver, and it is a bypass shunt. Savan is right. It is between the umbilical vein, and ऊपर क्या है? ऊपर we have the inferior vena cava, and down we have the umbilical vein. So ductus venosus is a bypass channel or a shunt between the umbilical vein and inferior vena cava. Yeah, you can say that. Portal vein also, but the best answer for this question, I would say, yeah, umbilical vein and inferior vena cava. Down you have the, okay, don't see the low wala answers. Okay, yeah, umbilical vein and what you call inferior vena cava. Ductus venosus, yes, Hamid is right. This one, Deepak is right. Very good, Deepak. Very good, brother. And yeah, okay, very good. Question number 69. I am a fetus in my mother's womb. What will be my total cardiac output? So, can anyone help me? What is the normal total fetal cardiac output? Anyone? What is the total fetal cardiac output? Normal? Any random guesses? Raghuvansh, Deepak, Kalpana, Rachna, Vaidehi, Sarika, and Savan and Priya. So, yes, the best answer. Priya has already given the best answer. Then we have Sarika. Very good. Very true. And Rachna, Osama, everyone is answering. Very good. 450 ml per kg per minute. The total fetal. See, देखो क्या होता है. Listen. पहले first there is a fetus, right? Once the fetus comes out, he becomes a newborn. Yes or no? So remember 450 and 350. 450 ml per kg per minute is nothing but total fetal cardiac output. Okay, and 350 ml per kg per minute is the a cardiac output in a newborn baby. A cardiac output in a newborn baby. Exactly right. Rachna is right. Neonatal cardiac output is 350 ml per kg per minute. Fetus cardiac output is 450 ml per kg per minute. And so 450, 350, and what else? And 250. Remember, this was the homework I gave you. 450, 350, 250. 450 is the normal fetal cardiac output. 350 is the cardiac output of a newborn, and 250 250 microgram per dry weight of hepatic copper content. This is the diagnostic for Wilson disease. This is the diagnostic for Wilson disease, yes or no? So this is what we need to understand. The diagnostic for Wilson disease. Wilson disease, copper everywhere. So hepatic copper increases, serum copper increases, urinary copper increases. Only one thing decreases, that is the serum ceruloplasmin levels. That is the serum ceruloplasmin levels. Yes or no? And the gold standard investigation of choice is liver biopsy. In the liver, if you cut my liver, you will see my hepatic copper content in the liver, and that should be more than 250 microgram per gram dry weight of hepatic copper content. Done. Perfect. Over. Question 70. Very easy. Trilogy of Fallet. Trilogy of Fallet consists of all except. क्या जवाब देंगे इसका? Options are right ventricular hypertrophy, atrial septal defect, pulmonary stenosis, and ventricular septal defect. Anji batao, Rachna, Kalpana, Priya, again Nishi, Hamid, Pak, and our Dr. Savan from Savangri. Anji, very good. Yes. Okay. Trilogy of Fallet. So we all know that for the newcomers, again, this is the four-chambered heart. And how will I remember Trilogy of Fallet? The mnemonic is RAP. I am a rapper. R for right ventricular hypertrophy. Yes or no? A for atrial septal defect, which is the left to right shunt. P for pulmonary stenosis. So R A P rap. I am a rapper. ओवरराइडिंग स्टेफिलोकोकस ओवरराइडिंग ऑफ एओर्टा आ कहाँ से गया? इधर आ जरा, इधर आ तुम. स्टेफिलोकोकस व्हाट? कम हियर बेटे. ओवरराइडिंग ऑफ एओर्टा, ये जबान कैसे निकला तुम्हारी जबान से? Where is overriding of aorta? Overriding of aorta is in tetralogy of Fallet, bro, and we're talking about trilogy of Fallet. Yes or no? Yes. So that's what trilogy of Fallet consists of everything except the best answer is D. D is the best answer. VSD is not a component of the trilogy of Fallet. Question number 71. Pentalogy of Fallet. Pentalogy of Fallet consists of all except. Now tell me the answer. Will tell me. Every one of you will get very good marks in your exams. The way you are answering, and it's very nice. We are almost coming to the end of cardiology. Only one or two topics are left. I have to take a 1 hour class on tetralogy of Fallet and 1.5 hour class on coagulation, and then our whole cardiology. Then to we'll go for rheumatic fever and rheumatic heart disease. That John's criteria, major and minor. Very easy, very easy, very easy, very easy topic. हाँ जी, क्या आंसर लिख के आए हो जरा बताओ. हाँ जी. So yes, of course, yeah, patent ductus arteriosus कहाँ चला गया इधर? Patent ductus arteriosus is not a component. Patent ductus patent ductus arteriosus is not a component of pentalogy of Fallot, and all others are the component of pentalogy of Fallot. You see pulmonary stenosis, right ventricular hypertrophy, overriding of aorta, ASD and VSD. PDA is not a part of pentalogy of Fallot. Question number 72, which is the most common congenital heart disease seen in the picture? Which is the, हाँ जी एक second, after cardio what you gonna teach? So dear, after cardio एक तो we are left with tetralogy of Fallot, then we are left with coarctation of aorta, then rheumatic fever, and then rheumatic heart disease and congestive cardiac failure. This is the lined up topics which we are yet to cover, and every single topic is important, and then our cardiology will get over. So okay, what do you want to learn? Okay, I'll give you options, guys. Do you want to do you do pancake? You're very funny. So, do you want to read CNS? Do you want to read a respiratory system? Do you want to read diarrhea, dehydration? Or do you want to read infectious disease like measles, mumps, rubella, and what you called chicken pox and all those things, entry fever? What do you want to study? Anyone? What everyone wants to study? Infectious disease, that is very easy. कुछ टफ सा बताओ, इजी तो कोई भी पढ़ लेगा, बताओ। हाँ जी, CNS, तुम्हारी मर्जी, whatever you say. Okay, infectious disease also is a very good topic. CNS also is a very wonderful topic where we'll talk about neural tube defects and everything. Good evening sir, I'm late. Robin, लेट कैसे हो गए तुम? 50 मिनट हो गए मेरे को आए यहाँ पे, कहाँ थे तुम, किसके साथ थे? बेटा ब्रो क्या है ये, इतना लेट क्यों आ रहा है भाई? खत्म होने वाली है क्लास, 5 मिनट रह गए बस। हाँ जी, infectious disease, ठीक है चलो, we'll talk about infectious disease once we cover the full cardiology, then we'll go for infectious disease. ठीक है, देख लेंगे। Question 72, yes, हाँ, okay, very good picture, very good picture. Who will tell me, anyone who can tell me a very fast answer? What is this picture, my dear friends? What is this picture? Very important, let me zoom it for you. What kind of feet do you see in this picture? Anyone? किस तरह के feet हैं ये? The height part. Anji, what kind of feet do you see in this picture? Wi-Fi not working? Okay, fine. Now it is working. Okay, I can understand. No problem. Anji, बताओ जल्दी. Can you please teach ophtha pancake? बस लो जी लो. I'll do one thing. I'll teach you medicine. Then I'll teach you. Then I will teach psychiatry. Then we'll forensic medicine. है ना? Idea कैसा है ये बताओ. I think it's a good idea, right? Anji, yes, the Priya is right. This is nothing but, very importantly, rocker bottom feet. This is nothing but rocker bottom feet. Yes or no? Where do you see rocker bottom feet? Rocker bottom feet. It's seen in Edwards syndrome. Yes or no? What is Edwards syndrome? Which trisomy? It is trisomy 18, right? We have trisomy 13, which is a Patau syndrome, trisomy 21, which is a Down syndrome, and trisomy 18, which is a Edwards syndrome. Edward syndrome, exactly. ठीक है, cardiac master, I'll tell you, I have to read that one. Why surgery is contraindicated in Eisenmenger syndrome? Because the thing is, like, there is no use of doing reversal of shunt. In a case of Eisenmingerization, and then you do a repair, some book says that the patient will not, you will not, the patient will not get benefited out of the surgery. That is why it is contraindicated. हाँ जी, okay. अच्छा ठीक है, तो okay, pancake dear, let's do these questions. Question number, Edwards syndrome. Which is the most common congenital heart in Edwards syndrome? Anyone? The options are ASD, VSD, PD, and TGA. What do you think? Which is the most common congenital heart in Edwards syndrome? क्या बताओगे? What will you answer for this? Let's finish the topic fast. It's 5:20. I have to go to running at 6 o'clock. Only 10 minutes left. Then I have to go for running. I'll run for 4 kilometers. I'll become more thin and more smart. Hmm. Cardiac. Oh, क्या बात है. Dr. Savan is giving his expert and fine opinion to the cardiac master. Very good, Savan. That shows that you are my brother. Okay. Exactly right. Very true. Tanu is right. Everyone is, I think, very right. The mnemonic for Edwards syndrome is nothing but Rocky M. Rocky M. R for rocker bottom feet. O for overlying digits. Overlying digits. C for cardiac defects. K for kidney defects. Y for microcephaly. Microcephaly. And M for mental retardation, which is now known as intellectual disability, which is now known as intellectual disability. Yes or no? याद है, इतना याद है सबको? कम हियर। मेरा एक फ्रेंड है दीपक, मैं उसका जाता हूँ रनिंग के लिए, सावन के साथ ही जाऊँगा मैं। बहुत तेज़ भागता है, हम दोनों बहुत तेज़ भागते हैं। ठीक है, सो मेंटल रिटार्डेशन विच इज नाउ नोन एज इंटेलेक्चुअल डिसेबिलिटी, ठीक है, डन. नाउ द क्वेश्चन फॉर द choices, which is the most common congenital heart in Edwards syndrome, dear, the answer is VSD, ventricular septal defect. VSD will be our best answer in a case of Edwards syndrome. Okay, question 73, only 5 minutes left. I think let's finish fast. Question 73. I am a preterm. My ductus arteriosus is open. Doctors said they need to close my ductus arteriosus. Which drug will be best for me to close the ductus arteriosus? The options are ibuprofen, aspirin, clopidogrel, and PGE. What will you answer? डॉक्टर सावन सिंह क्या आंसर करोगे आप? मैंने बहुत सारे कमेंट्स पीछे वाले भी नहीं पढ़े. ये सारे कमेंट्स हैं, मैं पढ़ूं कैसे? मैरिज फोल्डर वाला तो बहुत ही फनी था. पैनकेक, दैट वाज रियली फनी, सीरियसली. ओके. हाँ जी. So yes, I think Sarika, Rachna, and Raghuvansh and Deepak is very right. Deepak, you are still online. I don't know how come. So ibuprofen. Yes, the ibuprofen will be a good drug of choice if doctor wants to close my patent ductus arteriosus. Question number 74. I am a preterm newborn. Doctor said he wants to keep my ductus arteriosus open. Now, which drug will do the best? Anyone? Which drug will do the best? Will options are PGE for PGE1, paracetamol, and none of the above. हाँ जी. Anyone? 10 and 15 क्या बोला दीपक? 10 and 15 क्या ब्रो? मुझे अच्छा डोज बता रहा है. क्या बात है यार, बढ़िया है. वेरी गुड. Exactly. If you want to keep my ductus arteriosus open, please give me PGE1 analog. You will give me PGE1 analog, that is L-prostadil. We give through infusion pump. कुछ 0.1 माइक्रोग्राम पर केजी ऐसा डोज होता है. इन्फ्यूजन पंप से देते हैं. हमने एक ही बार दिया था. और नॉर्मली तो आइबुप्रोफेन से बढ़िया खुल जाता है पीटीए. क्वेश्चन 75. PGE1 is given by which route? IV, IM, oral या subcutaneous? Question 75, dear. What will you answer? PGE1 is given by which route? You want to give IV, you want to give IM, you want to give subcutaneous or oral? हाँ जी. अच्छा, ओहो क्या बात है, कितना अच्छा होता है. ओके, दैट्स नाइस. एक डॉक्टर एंड कैफीन ने बड़ा अच्छा सा बताया कि दिल दिल के लिए यूज होता है एल प्रोस्टाडिल. दैट इज वेरी नाइस. थैंक यू, थैंक यू. मुझे ये तो बड़ा ही प्यारा सा लग रहा है. वेरी नाइस, थैंक यू सो मच डॉक्टर एंड कैफीन. एल प्रोस्टाडिल कैसे याद रहेगा? दिल दिल में जो यूज होता है वो है एल प्रोस्टाडिल, ऐसे याद रखना, ठीक है. हाँ जी, हाँ जी. अच्छा, आईवी, एग्जैक्टली. द बेस्ट क्वेश्चन इज PGE1 is given by which route? Intravenous. Intravenous route we give PGE1. Intravenous. ठीक है. आईवी देते हैं हम इन्फ्यूजन पंप से. क्वेश्चन 76. इन केस ऑफ कंजेनिटल हार्ट डिजीज इन अ न्यूबॉर्न, विच वैक्सीन वी मस्ट लुक फॉर इन द मदर्स एंटीनेटल हिस्ट्री? तो क्लासिक क्वेश्चन, super speciality question. In the case of congenital heart disease in a newborn, which vaccine we must look for mother's antenatal history? मदर ने वैक्सीन मदर ने क्या नहीं लगवाया होगा जो बच्चे को हो सकता है हार्ट डिफेक्ट? द ऑप्शंस आर लाइक हेपेटाइटिस ए, हेपेटाइटिस बी, रुबेला एंड बीसीजी. क्वेश्चन 76. Yes, pancake is somewhere right only. So question 76. The question 76, the best answer will be exactly rubella. Question 76, congenital rubella syndrome. We know that like cafe coffee day, yes or no? The triad of congenital rubella syndrome is congenital heart disease, that is PDA, then cataract and deafness, right? Yes or no? मैंने पहले खुद ही बता दिया था, मुझे पूछना चाहिए था. आई थिंक मैंने अच्छा मैंने पूछना चाहिए था, आई थिंक. तो यस, रुबेला का वैक्सीन मदर को, विच वैक्सीन वी मस्ट लुक फॉर in the mother's antenatal history? The answer is rubella. Rubella देखना चाहिए. Very good. Saman is right. Rubella causes congenital rubella syndrome. The mnemonic is cafe coffee day. Question 77. Indomethacin and ibuprofen are not effective in full-term children. Now, is this line true or is this line false? Indomethacin and ibuprofen are not effective in what you called in full-term children. Anyone? Any random guesses? Indomethacin and ibuprofen are not effective in full-term children. Is this true or false? Yes, it is very, very, very true. Okay, indomethacin and ibuprofen are helpful in preterm babies. Preterm baby should have a open PDA. The more the baby is preterm, I assume that its ductus arteriosus will be open. So preterm baby will have a open ductus arteriosus, which is quite normal and common. more the baby is born preterm, the more chances are there his PDA will be open. Yes or no? So that's what. And what else? So yeah, so indomethacin and ibuprofen are not effective in full term. Full term baby में ductus arteriosus नहीं खुला होना चाहिए. Any full term baby having ductus arteriosus open is a problem. I need to do a surgical closure, right? So indomethacin and ibuprofen are not effective in full term children. They are effective in preterm children. Exactly. Sandhu is right, only in preterm. Question 78. For diagnosis of congenital heart disease through NADA's criteria, how many major and minor criteria are required? Very easy question. जल्दी बताओ. 4 minutes left. मैं 100 question तक नहीं करूँगा वरना मैं जितने होंगे 5:30 तक I'll do that only. हाँ जी. Question 78. For diagnosis of congenital heart disease through NADA's criteria, how many major and how many minor are required? Exactly. Anyone? So exactly one major, 1+2. Remember हमने अभी शाम को ही पढ़ा है. 1+2, one major and two. Right? Very good. Question 79. Which is the most common congenital heart disease in the image shown below? The very good picture. Very good picture. Pancake should answer. Pancake कहाँ चलेगी? बस बातें बातें करी. Pancake is out. हाँ जी. Pancake बेटा ब्रो बातों के अलावा आंसर भी कर दो. ठीक है बताओ. Which is the most common congenital heart disease is seen in the image shown below? सीधा आंसर. I like Zara. Okay, let's have a ये छोड़ के ना बस बातें करने का मन कर. Okay, which is your favorite? I have a question for everyone. Which is your favorite t-shirt brand? Okay, the options are Levi's. The options are Zara. The options are Ellen Soli. Which one? Which one you like? Anyone? What's your favorite? To be frank, I like Zara. I like the wrinkle-free shirts. I love wrinkle-free actually. I don't like the normal one. I like the wrinkle-free. My size is large. बहुत पतला हो गया मैं. ये हिल फिगर. अच्छा हिल फिगर. You like Zara? हाँ. UCB is also nice. सावन बेनिटन के अच्छे होते हैं. मुझे तो स्वेटर्स बहुत अच्छी होती हैं. हाँ जी. रघुवंश से जो फिट आ जाए वो फेवरेट ब्रांड है. आई थिंक रघुवंश इज हैज़ अ बेटर आंसर भाई. जो जो फिट आ जाए वही वही बेटर ब्रांड है. आई थिंक दैट्स फाइन. ओके. पैनकेक. पैनकेक यू लाइक मैंगो. मैंगो पर मैंगो इज डिफरेंट एंड ज़ारा इज डिफरेंट डूड. मैंगो ज़ारा हाउ कम इज सेम? वो इज डिफरेंट. ज़ारा इज डिफरेंट जो जितना मुझे पता है. आई डोंट नो. आई माइट बी रॉन्ग. यूसीबी इज़ गुड. यस यूसीबी इज़ वेरी गुड. एलन सोली अच्छा कम लोग यूज़ करते हैं. अच्छा. मोडा इटालियनो. इटालियनो तो ब्रांड मैंने पहली बार. हाँ है ये. हमें भी दिखाओ हम भी कहीं कुछ ले. अच्छा मैंगो एंड ज़ारा. इट्स गुड. गुड चॉइस. गुड चॉइस. नाइस भाई. एंड लिवाइस की ऑफ कोर्स आई थिंक वी ऑल नो दैट लिवाइस जीन्स इज़ वेरी गुड. लिवाइस जीन्स इज ऑलवेज वेरी गुड. भाई लंबी चलती है. क्वेश्चन नंबर 79. अब हम क्या कुछ पढ़ाई की बातें करें. इफ़ यू डोंट माइंड कैन वी टॉक अबाउट स्टडीज. थैंक यू. तो विच इज़ द मोस्ट कॉमन which is the most common congenital heart disease seen in the image shown below? हाँ जी क्या है ये इमेज. सावन ब्रो कौन सी इमेज है ये? तेरी शक्ल तेरे हाथ है ये. तेरा हाथ तो नहीं लग रहा मेरे को. बता क्या है ये. The one with the absent thumb. Anyone? What is this? Have you heard of Holt-Oram syndrome? Holt-Oram syndrome. Yes or no? Kind of a thumb is absent. Yes or no? Holt-Oram syndrome. Right? Yes. And what else? गलत आंसर क्यों दे रहे हैं? डॉक्टर एंड कैफीन. Why are you giving the wrong answer, dear? So question number 79. For question number 79, the best answer is the most common congenital heart in Holt-Oram syndrome. You know which is the TBX5 gene mutation. Holt-Oram syndrome, where the absent thumb, kind of a thumb is absent. Yes or no? And most importantly, the most common congenital heart in Holt-Oram syndrome is ostium secundum type of atrial septal defect. Please remember, most common congenital heart disease in Down syndrome is ostium primum type of atrial septal defect, and most common congenital heart in Holt-Oram syndrome is ostium secundum type of atrial septal defect. Hanja Holt, ha, very good, very nice. Question number 80. Fill in the blanks. Which is the most common type of VSD? Which is the most common type of VSD? Anyone? Any random guesses? Sir, because you said गलत ही दे दो. Very good, very good. Doctor and caffeine said very nice quote कि सर आपने बोला चाहे गलत ही दे दो आंसर पर आंसर दो ज़रूर. Very good bro, I'm so proud of you. सच कह रहा हूँ बहुत हेल्प होगी. दे दो सारे गलत याद तो रहेगा है ना. Yes or no? हाँ जी very good bro. अच्छा तो हाँ जी which is the most common type of VSD? Is the membranous VSD very common or is the muscular VSD is very common? Yes, the 80% cases membranous or some book says perimembranous VSD is very common. I think 80 questions are enough. It's 5:31. I have to take a bath. Question 81, chalo batao. I am a 2-year old. What is my diagnosis according to the image shown below? And I'll give you a hint. I have a broad smile and I have a gregarious personality. Gregarious matlab outgoing personality. So what is this? What is this? Anyone? Let me zoom the picture for you. This one. Very, very, very beautiful picture. This is a starry burst. Chand chamak raha ho. Star burst kar raha ho. Starry burst iris. Yes or no? Starry burst iris. Where do you see that? You see that in William syndrome. Yes or no? William syndrome. याद रहेगा ये? हाँ जी. Very good. Perfect. Next question. Question number 82. काफी I think I am a preterm newborn with bounding peripheral pulses. Very good question. Bounding. Dekho, I'm telling you, cardiology now, it's so beautiful that just by the word itself, you should able to tell the diagnosis. Bounding peripheral pulses, wide pulse pressure, plethoric lung fields, easily palpable dorsalis pedis artery, and hyperdynamic recordium. What is the answer? Dr. Savan Singh, pancake I'll share to you. I'll share. I'll put on the social this. Yeah, you'll get it. Okay. Anji, what do you exactly? Very good, very good. Patent ductus arteriosus. Yes or no? Patent ductus arteriosis patient. मैंने उस दिन during the PDA class also, dear, I told you that easily palpable dorsalis pedis artery, bounding peripheral pulses, ductal steel phenomenon, hyperdynamic precordium, wide pulse pressure, and what else? What else? Yeah, all those conditions are PDA only. Question 2083. Question 83. TGA is the most specific congenital heart disease in which disease? TGA is the most specific congenital. This is the last question. TGA is the most specific congenital heart disease in infant of diabetic mother. Infant of diabetic mother. Yes, Rachna has nailed it. Very good. The most common congenital heart in infant of diabetic mother is a VSD, and the most specific will be TGA. Most specific will be TGA. In infant of diabetic mother, the mother will be hyperglycemic and baby will be hypoglycemic because of the Pedersen's hypothesis. What is Pedersen's hypothesis? We have done a infant of diabetic mother 1 hour of lecture we have done. You need to watch that. And that's it. जाने से पहले ये है हमारा आज का ख्याल. That finishes today's session. 83 questions ही करेंगे. Tomorrow we'll start off with another session and then we'll see to continue this topic. And हाँ जी, तो जाने से पहले हमारा ब्यूटीफुल कोट जो कहता है क्या, नाइट क्लास. अच्छा, पैनकेक इज आस्किंग व्हाई नो नाइट क्लास टुडे. आज वैसे ही यार, दिन में 3 क्लास ले ली मैंने आज. टुडे आई टुक 3 क्लासेस. मॉर्निंग 11 o'clock, देन 2 o'clock, देन 4:30. इंसानियत नाम की होती है नहीं होती, ये बताओ. आई जस्ट चेक वंस इफ आई हैव अ क्लास इन द नाइट. आई डोंट थिंक सो आई हैव अ क्लास. आई थॉट फुल डे 3 घंटा बहुत होता है. और क्लास लेनी है, और क्लास लेनी है. 1 second, आई जस्ट चेक इफ वी हैव अ क्लास piled up today or not. Second, आज कौन सी तारीख है? इज 7 and 4:30. Yes, we only have 3 classes, my dear. आज शांति रखते हैं. हाँ जी, एक वन मोर जरूर सपने में लेते हैं आप. जाने से पहले ये है हमारा आज का ख्याल. Before going, the motivating quote for tonight is someone else is happy with less than what you have. Someone else is happy with less than what you have. So I think इसी बहाने just be happy. So someone else is happy with less than what you have. So this is the most beautiful quote of today evening. Thank you so much everyone for this wonderful participation. Life is just one. Be happy and be amazing. And yes, fine. And tomorrow we will meet. And आज सोने से पहले, before sleeping, guys, I just want you to just update. I mean, like, just go to the Unacademy app. Just check if I have a class tomorrow. And I think I have a class tomorrow. Let me. I only will tell you 1 second. I have a class. I have a super class tomorrow. Yeah, I have. I always write everything in a copy. Because 1 second, I'll tell you. Do you have a class or not? तो क्या करेंगे आज शाम को? What all you guys are doing? Hmm. Okay. Yes. Tomorrow is what? Tomorrow is Monday. Monday 17th. Yes, I have a class tomorrow. We have a class at 5:15 p.m. and tomorrow we have a class at 8:30 p.m. Same two classes we have on the YouTube channel only. 5:15 and 8:30 tomorrow we have a class. And yes, Pancake, I will see the course. Thank you so much, everyone. Tomorrow we have two classes in the evening for in the YouTube channel here. Please, if you are free, please come 5:15 p.m. and 8:30 p.m. And before leaving, again, this quote was amazing. Someone else is really happy with less than what you have. I think it's good to be happy, however, whatever. Thank you, Deepak. Thank you, Deepak. You're still there online. Go. You're in train. Be other. Take care. Have a wonderful time, everyone. And thank you so much for all the love and support. And see.